Hello everyone, this is Dr. Sushma Sarilla, consulting homeopath at Fidicus Homeopathy. Now let's get into the types of tinea. Remember that based on the place or the area where the tinea or this ringworm is affected, it is called a different name. It is different in head if it is affecting the scalp area. It's called differently if it is affecting the nails. It is called differently if it is affecting the body. So first let us know about Tinea Pedis. So by pedis we mean foot. It is also called as athlete's foot. So who are prone to this? People who wear socks for a longer period of time, who are sweaty or have sweaty foot and they do not change their socks frequently. These people usually have this Tinea Pedis. So what happens is that usually in between the skin folds of these toes, the tinea will start. So whenever you're bathing, make sure that you put your soap or whatever body wash that you're using in between your toes also. If you are having a sweaty foot or smelly foot, make sure you clean them either in Epsom salt or you put a little bit of salt in hot water and soak your feet so that your foot is clean. And also make sure if you have any skin abrasions or any cuts in your feet, do not walk on the floor without any footwear. So it usually affects the skin folds and then it goes here. It is very itchy in nature. It is a red and it is inflamed. This is called as Tinea Pedis. This is called as Tinea Cruris. What is Cruris? Cruris means the area which is connecting the trunk part and the leg part. That area is called as loin. So if the tinea is affecting the loins, that is the area connecting the trunk and the leg area, because it is folded, because there is every chance that you get sweaty because of the lot of clothes that you put and also the hot humid weather, many people suffer from this Tinea Cruris. Even if you see in the advertisements, they will show Tinea Cruris, that is Jock Itch, that is the area between the trunk and the leg area, okay, connecting part. So this Tinea Cruris affects the loin area. It is very itchy in nature, and if there is no stopping of this spread, it can even spread to the genital area as well. Next one is called as Tinea Capitis. So the problem with Tinea Capitis is that many a times that this wherever the ringworm is affected and if it is spreading rapidly, the person is immunocompromised, you will see that you will have two types in it: inflammatory and non-inflammatory. In non-inflammatory, you will not see any sort of redness in that tinea area, but you will only see alopecia, that is falling off of hair in bunches in the area that the tinea is affected. It is usually seen in severe cases that the alopecia occurs. And also in inflammatory cases, what we see is that after the hair has fallen, you will see that there is this red color, severely red, severely itchy, yellowish tinge on that area where the hair has fallen or alopecia has taken place. This is called as Tinea Capitis. By sharing combs or hair products or even anything that is related to the scalp, any product that is related or any instrument that you're using for their hair, if one person is suffering and you are using that, you will have every chance that you will be affected by this Tinea Capitis. So make sure that you clean your comb at least once in a week, washing or using soap. Next is your Tinea Unguium. What is Unguium? Unguium means nails. As you can see, it occurs near the nail part, as you can see here. So even the nails become crooked, they become dark, they become thick, and sometimes they break off easily also. They become thick in one area and they become thin in one area, so they break off easily, and it is affecting even the nail bed also. It is very itchy in nature. If you're using nail cutters or anything to do with the nails, even if you're going to nail salon also, make sure that they are using sterile equipment. That is, once they use for one person, then they should be sterile or they should be free from bacterial contamination while that same product or that same material is used for another person. When you go to salons, make sure that you're going to a proper salon where there is cleanliness. And also even your nail cutters, one person nail cutter should not be shared with the another one, because the nail, we will have lot of deposits in the nails which will not see properly. If you see microscopically, there are a lot of dead debris cells and also a lot of dirt inside the nails if you're not cleaning it properly. So make sure that your nail filing stuff or your nail cutting equipment should not be shared with other person. Next, the Tinea Corporis. It is most common form of Tinea. Corporis means it can affect the body parts. So it affects the underfolds of the breast, it can affect the elbow area, it can affect the knees, or even it can affect the back of the person. So this Tinea corporis, it can spread very rapidly. It is most common in people who are very unhygienic, who do not bath on a daily basis, and also who share their clothes or their bed linings with other people. So where is it more common? All of these three things are very common in hostels. So people who stay in hostels should be very careful, and also make sure that you're washing your clothes properly. And if you're suffering from Tinea corporis or any form of tinea, make sure that you wash your clothes in hot water and then dry them out in direct sun. This will cause the spores to dehydrate and it will not affect the other person. So people who are sharing their bed linings or people who are staying in hostels are more prone for this Tinea corporis, and also people who are unhygienic or who are immunocompromised. Coming to the consultation part, if you're suffering from tinea and you're looking for cure and you want to contact us, here at Fidicus Homeopathy, we are offering you with two different types of consultations. One is online consultation, the other one is offline consultation. If you're staying nearby the nearest branch of Fidicus, you can come and visit us in person and take doctor consultation. But if you are staying far away from us, you can connect us either through audio online call or through video online call. There are two facilities in online consultations. After doctor consultation, if you are having any sort of investigations, you can share it with us, and if you need further investigations, we will let you know. After this process, the medicines will be delivered directly to your doorstep. If you're staying in India, 3 to 4 business days. If you're staying in USA, 3 to 5 business days. And if you're staying anywhere else, it can take 4 to 8 business days for our medicines to reach your doorstep. If you're seeing this channel and if you're suffering from tinea or any other skin diseases and you would like to get in touch with us, you can call us on this number, you can message us, or you can WhatsApp us on this number. And if you would like to know more about Fidicus Homeopathy, you can check our website www.fidicus.com. If you're suffering from tinea or if you're suffering from any other skin diseases and you're looking for a proper cure, why should you opt for Fidicus Homeopathy? Because here at Fidicus, it stands for highest chance of health. Here we follow three things. One is already the highest success rate we are seeing in the skin diseases sector, that is Fidicus skin, and also in this ringworm cases. The treatment we give here is transparent, that is, we discuss with the patient what is the prognosis of the case, what is the status of the case, and also the personal care we give here at Fidicus is top notch. Any sort of queries that you have, myths that you have, we will educate you on that. If you're looking for proper cure, choose Fidicus Homeopathy. Thank you.
Fidicus Homeopathy.